In this video, we are going to talk about the terms that are related with anesthesia. So the first term is anesthesia itself. Anesthesia means that the animal is completely unconscious as well as it has no response to painful stimuli. Then we have is sedation. Sedation means the animal is nearly unconscious but not completely unconscious. So, nearly unconscious and it has purposeful response to the painful stimuli. Next we have is a tranquilization. Tranquilization means that behavioral change where anxiety is relieved, which means that your animal is basically either angry, agitated, irritated. So, what you will do is inject him a tranquilizer drug, and your patient will become relaxed, but he will also be aware of surroundings. So, in tranquilization, animal does not goes under central nervous system depression. That means he remains aware of the surroundings. Whereas in sedation or anesthesia, the animal undergoes CNS depression. That means animal goes under unconsciousness. So basically, I have described or defined these terms in relation with each other, so that when in further lectures these terms will appear, you should know what are the difference between these. So in anesthesia, there is complete unconsciousness and no response. Sedation is nearly unconscious and purposeful response to the painful stimuli. Meanwhile, the tranquilization, the anxieties will be relieved, patients will become relaxed, but they will also be aware of the surrounding. Now that they won't be under unconsciousness. And the drugs that cause tranquilization are called either anxiolytics, anti-anxiety, or as tranquilizers. Next we have is narcosis. Narcosis means deep sleep from which patient cannot be aroused easily. So, you have those sleeping pills, if an animal or a human eats those pills, etc., you cannot wake them up easily until unless the drug has completed its course of action and time duration. So, that was narcosis, which is deep sleep. What is hypnosis? Hypnosis is artificially induced sleep or trance resembling sleep resulting from moderate CNS depression from which patient is readily aroused. So if an animal is in a sleep type of situation from which he can easily be aroused, it will be hypnosis. But if it is a deep sleep and the patient is not being easily aroused, it will be narcosis. Next, we have is balanced anesthesia, which is anesthesia that is achieved by multiple drugs, and it should have three major properties unconsciousness, analgesia, and no reflex to the any stimuli. If these properties are attained, you will be having balanced anesthesia through multiple drugs. Then we have is dissociative anesthesia. These are the drugs that basically dissociate thalamocortic and limbic system, and these drugs are basically different from general other anesthetic drugs because these anesthetic drugs just do completely unconsciousness or like CNS depression, but these dissociative anesthesia, they act in a different way, like they dissociate thalamocortic and limbic system. So animal remains in a cataleptoid type of a state where the eyes will remain open, but swallowing reflexes will be intact and skeletal muscles are contracted, but still in this state the animal won't be feeling any pain of any painful stimulus. So he will be having the no painful response to no painful stimuli, but still animal will be having eyes open, intact reflexes, etc. So that's the difference between anesthesia and dissociative anesthesia. That was all for this video. Thank you.